Good afternoon. So today I am going to perform batting an adult client. So the purpose of this procedure is to remove transient microorganisms, body secretions and excretions, and dead skin cells. Also to stimulate circulation to the skin, to promote a sense of well-being, and also to produce a relaxation and comfort, to eliminate and prevent the unpleasant body odors. Then assessment, physical and emotional, such as fatigue, sensitivity to cold, need for control, anxiety, and fear. Then conditions of the skin, such as the color, texture, or turgor, and presence of pigmented spots, temperature, lesions, excoriations, abrasions, and bruises. Areas of erythema or redness, then on the sacrum, bony prominences, and heels should be assessed for possible pressure source. Then presence of pain and need for additional measures such as analgesic before the butt, then range of motion of the joints, and any other aspects of health that may affect the client's body process such as the mobility, strength, and cognition. Also the need for the use of clean gloves, then of fall risk to the clients who wish to shower. Then some clients may have body piercing, so ask the client what hygienic measures are needed for the piercings. Before batting client, determine the purpose and the type of bat the client, then self-care ability of the client, then any movement and positioning precautions is specific to the client, and also other care the client may be receiving, such as physical therapy or x-rays, in order to coordinate all aspects of healthcare and prevent unnecessary fatigue. Then client's comfort level being bathed by someone else, then organize the necessary bath equipment and linens. To begin the procedure, introduce yourself and verify the client's identity. Explain what you're going to do, why is it necessary, and how can the client can cooperate. So good afternoon, ma'am. I am Risa Joyceron, a first-year nursing student of Camarines Polytechnic Colleges, and I will be your nurse for today. So what's your name, ma'am? Janet. Okay, so Ma'am Janet, today I am going to ibebedbag po kita for you to be comfortable and para na rin ma-stimulate your circulation sa skin. So later on, I will give some instructions if kaya niyo po. Okay? So next is perform hand hygiene and observe other appropriate infection control procedure. Okay, so we can use alcohol. Okay. Then next is provide for the client's privacy. Then next is prepare the client and the environment. So wedding invite a family member or significant other to participate if desired or requested by the client. Also close windows and doors to ensure the room is in a comfortable temperature. Then offer the client a bedpan or urinal, or ask the client to or ask whether the client wishes to use a toilet or a commode. Then encourage the client also to perform as much as possible self-care as possible. Then during the bath, assess each area of the skin carefully. So, ma'am, iusog po kita sa okay? Then next is prepare the bed and position the client appropriately. Next is place a bath sheet to the top of the top sheet. Then from the top, we're going to remove the top sheet. Then place this in hamper. Then remove the cloth. So assuming that that we assuming na na-remove na natin yung cloth ng patient. So next is wash the face. So first is we're going to place a towel under the client's head. Then first wash the eyes, but with water only. So, kung gusto niyo po ba na i-wash yung face niyo with soap or with water only? With soap. With soap. So, so now we're going to rinse the face with water. Then, after rinsing, you're going to dry. So next is we're going to clean the ears and neck. Then next is rinse with water. Okay. Then next is dry. Okay, so we're now going to start with the arms and hands. Okay, so going now to remove the towel. Then in lengthwise, we're going to place it on the far arms of the client. Okay, so then we're going to wash it with soap. Okay, so with a long firm stroke from the hands up to the armpit of the client. So to the armpit. Then next is rinse with water. Then next is we're going to dry. Okay, so to clean the hands of the client, we can using the basin and water with soap. We can soak the hands of the client directly on the basin, then clean so that we can clean the intermediate spaces of the hands. Then next is rinse. Then next is dry. So after cleaning the far arm of the client, we're now going to clean the near arm of the client. Okay, so first remove the towel. Then so first going to wash with soap. Okay, so clean with firm stroke. Up until to the armpit. Then next is rinse with plain water. Then next is dry. Then the hands of the client. Then next is rinse. Then dry the hands of the client. Next is wash the chest and abdomen. So, so we're going to place the towel from the chest to the abdomen of the client. Then we're going to unfold the butt sheet. Okay, so now we're going to start washing the chest of the client with soap. Then next is rinse. Okay, then dry. Then next is the breast. So since our client is female, we should dapat nating linisin mabuti the lalo na yung breast and yung sa ilalim na part ng breast ng client. The next is wash. Rinse. Then dry. To clean the abdomen part, we can fold the towel. So wash. Okay. Then rinse. Okay. The next is dry. The next is we're going now to ibabalik na natin yung top sheet. Ay yung butt sheet. Then remove the top. The next is wash the legs and feet. Okay, so place the towel. So we're going to wash with soap. So using a firm long stroke from the ankle to the knees and from the knees to the upper part of the legs. The next is wash. I mean rinse. Then next is dry. So next is we're going now to clean the feet of the client. So we can directly put the client's feet directly on the basin. But first we're going to flex the client's feet. So then wash. Then now is rinse. Then dry. So next is the near legs of the client. Okay, so this time remember that if the water is madumi na, we can change the water. So next is we're now going to wash the legs of the client. Then other hands up. Okay, so we're going to clean the legs of the client. Then rinse. Then dry. is the feet of the client. So going to first going to flex it, then clean the feet of the client, especially the intermediate spaces. Okay, so next is rinse. Then dry. Okay, so next is the back of the client. So first we're now going to assess the client into a prone or a side lying position. So, okay, so remember that raise the side rails of the bed. So now we're going to wash the back of the client. Next is place the towel. Okay, so next is wash with soap. Okay, so from shoulders. Okay, then rinse. Then pat dry. Okay, so next is the buttocks. Okay, so another. So since the client is female, going to we're now go we will clean the buttocks from here up to there. Then next is we're now going to rinse. Another one. Then dry. After that, we're now going to remove the towel. Then we're now going to assist the client back into the supine position. So next, assist the client with grooming aids such as powder, lotion, or deodorant. Dahil pa rin siyang supplyan. Then help the client to put a clean gown or pajamas. So assuming na napalitan na natin yung client na malinis na gown and pajamas. After that, document the following such as the type of bath given. For example, if it is complete or partial or self-help with assistance, then this is usually recorded on a flow sheet. Then skin assessment such as excoriation, erythema, exudates, rashes, drainage, or skin breakdown. Then also nursing intervention related to skin integrity. Then ability of the client to assist or participate with bathing. Then client response to bathing. Also document the need for reassessment or visual signs if appropriate. Then educational needs regarding hygiene and also information or teaching shared with the client or family. Okay, so that would be all. Thank you.